Good afternoon. Thanks for joining us, and I hope you at least took an opportunity to watch that quick video that our Think Dutchess Alliance for Business put together. So I want to start with that message. As we now are 3 days into the beginning of this incremental reopening of government and community activity in small businesses especially, I know that there are a lot of people who don't have resources, right? You've been without perhaps a paycheck, and I get that. I truly do. For those who do have the resources, we really are encouraging you, as you do, to make the decision to shop with one of our neighborhood businesses. We're going to ask you to continue to be vigilant in protecting your health, to be safe, and to wash your hands, use hand sanitizer, use a face covering, make those kinds of choices. We need to be vigilant in that. But we also now, as we restart the economy, and we need to also be vigilant in supporting our neighborhood businesses. This is more than just simply shopping local. These small business owners, many of whom are our neighbors, they sponsor our Little League teams. They support our school and our fire department charitable events. They've been on the sidelines and have been on life support for these last several weeks. And just as you leave the door to head out, you might remind yourself to pick up that face covering, that mask, or make sure that you brought some hand sanitizer in the car. I'm asking, if you have the resources and you have the ability to do this, to make the same kind of choice to spend your dollar in one of our neighborhood businesses. Those Main Street shops, those stores around the corner, from the bagel shop to the art gallery, to the local restaurant or the corner store, to any one of our great little retailers, from gifts to clothes. If you have the ability and you have the resources to make that choice, please do it. They need our help now more than ever, and we need to be a hero to them. And our small businesses, our neighborhood businesses, when they get that dollar from you and me, they spend it locally. They give it to a neighbor, a friend, a family member who might be employed there. They are more than likely, as a small business owner themselves, going to spend that dollar in another small business supporting one of those other businesses that make up the fabric of Dutchess County's community. So as we start this reopening process, and we are, it's just so critically important we show our support where we can for those businesses right around the corner. So as I said, and you know, Dutchess County in the Mid-Hudson region met all 7 of the state's measurements, these benchmarks, and we began the reopening process, this phase 1, this incremental restart of business activity. We began that on Tuesday. It is expected that over the course of the next 2 weeks, we will stay within those benchmarks. So again, assuming that we keep hospitalizations down, which we have, new admissions to the hospitals down, which we have, and slow the rate of transmission and ensure that we don't see an increase in severity of cases, we're going to transition to this next incremental step, this phase 2. Now, as of today, our expectation is that phase 2 of business reopening will begin on Tuesday, June the 9th. Now, I know that some of you may already be commenting, and if you have a question, please comment. You heard yesterday that the governor made a remark answering a question on a radio program that quite frankly made chaos in upstate counties. So as you know, this state is divided now into, I think, 10 separate regions. We are in the Mid-Hudson region. The upstate counties didn't see the severity of cases, and in fact, if you look at the transmission of the disease, it has been mostly close to high-density population centers like cities, mostly close to transportation lines like railroads or somebody coming overseas on a plane, and then it sort of dissipates from there. So there are pockets of cases in upstate New York that surround communities, principally city centers. We, of course, have a direct connection to New York City, so you see the cases come up the Hudson Valley, come up the rail line in the Hudson Valley and the Hudson River line. Hudson River as a divide, if you will, and so those counties were monitoring their numbers as we are. The counties, the 7 counties in the Mid-Hudson region, every day are on a call. I'll be on a call at 3 o'clock today with state officials. We review our numbers. During those last 14 days, when those upstate counties had already begun phase 1 businesses, they had maintained those numbers. They were assured by the state that they could proceed, and in fact, as late as yesterday, we're told today they would. The governor, in a comment on a radio program, said, nope, that wasn't going to happen. All of us as community leaders were shocked and angered and frustrated because we have in this state a decentralized form of government. I'm sorry to give a history, sort of a government lesson, but you've heard me complain about state mandates just about every day since I've been elected county executive. 70% of what Dutchess County does is mandated by Albany. But this is one of those moments where that mandate, that mandated service, is what makes this state unique. We are mandated by the state of New York to provide for public health. That is our job. As counties and the city of New York, we are required to provide for public health. So every day, whether the governor's asked or not, whether we're in a pandemic or not, county governments are engaged in providing public health services. We're responding to infectious diseases. We're working toward greater public health. We're monitoring contaminants and pollutants. That's what we are required to do. As we've monitored these cases and the data over these last 14 days, these upstate counties were proceeding. They were told that they would be able to proceed, and then suddenly that was put on hold. Well, the good news for all of them is that their data has been solid. They haven't seen any real growth that they share any concern for. Hospitalizations have been relatively steady in those upstate counties, and they are now proceeding to phase 2. The governor made that clear this afternoon at a press event. Those regions are moving towards phase 2. But I assure you that our position is very, very simple. Let us do our jobs in protecting the public's health. Let us make sure that we're slowing the transmission of the disease, and let us carefully, methodically, and as quickly as safe continue to incrementally reopen community activity. Earlier this afternoon, the governor announced those regions are moving forward. And I tell you all of this because our expectation is so long as we stay the same course, which is this flattening of those hospitalizations and flattening of cases, we're proceeding to the second phase of business reopening and community reactivation on Tuesday, June the 9th. So let's also talk a little bit about, I want to offer to you what the state has said now is in the phase 2 category. There was some clarity given this afternoon. So phase 2 includes now, and by the way, you can find this detail at dutchessny.gov. Please visit us at the county's website. You can also visit and follow us on Facebook or Twitter, and you'll get updated information. The state of New York has released not only what phase 2 businesses are, but also a fairly in-depth a set of guidances for businesses. And this is a good opportunity now, assuming we're ready to go for June the 9th, as if you fall in any of these categories, now's the time to go on the website, identify what your business is, look at those safety plan templates, and consider what you would do as you begin to reopen. So again, assuming phase 2 begins, and we are on we believe that we are headed in that direction. There is no indication as of yet that there is a reason for concern or delay, and we will proceed, assuming we hit those benchmarks and continue to flatten that curve as we have, that we will proceed to phase 2. Now, phase 2 includes all office-based jobs. So all office-based jobs. It will include limited in-store shopping. So all retailers would be asked to comply with a 50% capacity, which to some degree is logical, and that would be the next step. It also includes hair salons and barbershop services. Now, there's some detail in that, but again, hair salon and barbershop services as of this moment, all real estate services, all vehicle sales, all leases and rentals, all commercial building management, and employers will be required to provide their employees with personal protection equipment, masks, hand sanitizer, etc. So that is what phase 2 is. We are in the midst of phase 1, and businesses are starting to open up. Remember, it's a whole host of activities: manufacturing, construction and contractors, and retail. Now, retail can currently in Dutchess County in the Mid-Hudson region can include curbside pickup, delivery, and in-store pickup, and how small businesses accommodate for that. We leave to all of you with some safety and some guidance planning that's available that you can identify on the county's on the state website. You can get there through the county's website, so please take advantage of that. Now, as I said, just as we want to be vigilant in providing for our own safety, which is again continuing to wear the face coverings, and engage in the physical distancing, and the like. We also obviously want us to be focused on supporting our small businesses and our neighborhood businesses, and so please continue to do that, and we're grateful that you do. So wanted to cover a couple other things to give an update. As you know, Dutchess County with Ulster County began an aggressive effort to test all nursing home patients. We have 13 total nursing homes in Dutchess County. We have now completed 12 of those 13. If I'm correct, 12 of those 13 nursing homes. Tests came back for 4 more nursing homes this week. Our testing revealed only 8 untested confirmed positives. So these were eight individuals out of hundreds in 4 separate nursing homes that were asymptomatic at the time that did identify as a positive case of COVID-19. Now, we're continuing to work with our nursing homes, very grateful to those who are providing care for our loved ones. We're continuing to work with them to ensure that they meet the state regulations for testing and also access to personal protection equipment. So that's a little bit of an update there. Why don't we get to as many questions as we can, and I'll get caught up on a few other items. Joanne's asking if it might be less than 2 weeks between the phases. The answer is yes. The governor has said, just as yesterday, apparently he said it could be more than 2 weeks, which it has said. I mean, to be fair, if you look at the measurements, there has been reference if you don't stay within those benchmarks and we start to see hospitalizations rise, you could extend the pause period or the phases. But he has also said that they could accelerate, and we expect that as we start hitting those targets, that could happen as well. So that's possible. Jackie, what phases are thrift shops in? Well, right now a thrift shop is a retail shop, and they can open for curbside, delivery, or in-store pickup. Now that's a little bit complicated for a thrift shop, but it is an opportunity, it is a possibility. But based on what I just shared with you, Phase 2 includes all retail with 50% capacity, some limitations. So a thrift shop would be, you'd be able to entertain folks coming into the building for Phase 2. And for us, that should be June the 9th. Joseph, are businesses liable if someone gets COVID and it's traced back to their business? The short answer is that you only have a degree of liability if you're not taking steps to protect one another. So again, go to the state's website. I will give them a lot of credit. The guidance at the state website, you can get there through dutchessny.gov, includes a great amount of detail. You should have safety planning in place. If you have a plan and you follow the plan, you minimize your liability. If you totally ignore the planning, you do assume certain liability. And as a business owner, the only thing I would offer to you is if you want to make those decisions, that's fine. We'd encourage you to try to implement those safety plans. But if you do otherwise, you really will want to talk to your insurance provider, because you don't want to be in a position where you've put somebody at risk and then don't have the protection that you would ordinarily have. So that's number one. I think it's important, but it's not simply because it was traced back to you. It would have to be something that you did egregious or some degree of negligence, because again, this is an infectious disease. It is likely to be transmitted, and we know that it's transmitted in a number of ways, and simply because it happened in your place of residence or business doesn't open you up to liability. But again, you want to have those safety plans in place, and you want to try to adhere to them, and you can get them on the county's website for more information, okay? Anything new for therapy and school for kids with special needs? The answer is no, and I am equally angry with the state as you are. This is not the kind of service that you can simply wait and explain after the fact. Kids with special needs, with developmental disabilities, they may have an IEP for their school. services. They need to know, and school districts need to know how they're going to provide those services this summer. I believe, again, through the summer, based on this incremental restoration of activity, which is important. Remember, I will tell you, earlier in the week, somebody said, well, it's not safe to have kids with an instructor now. That may be true, but we're not talking about now. We're talking about the first week of July when summer school begins. And by July, this county, assuming our cases remain where they are, will be in the midst of the third phase of reopening, and that includes restaurants and larger social activities. So from our perspective, not only do we feel it's safe, it's necessary. Certain young people, and of course all young people deserve and need that in-person education, but those with IEPs, those with certain therapies, need in some cases to have that physical connection. And frankly, in some ways, technology will never compensate for that. In other ways, families can't make it work any other way. And I will just tell you, I think it's criminal if this state doesn't make clear what those expectations are, what the guidance will be, and give direction to families and others. And I'm sorry, it is just shameful that it hasn't happened as of yet. That's my opinion, and I'm sticking to it. Dental offices for routine cleanings, we thought would be in phase 2. So again, if phase 2 is all office-based jobs, we don't know yet. The state hasn't made that clear. But again, we believe that could be phase 2 or possibly phase 3. You can still, and you'll have to talk to your dentist directly or their offices directly. They can still do emergency services or essential services as necessary, and some are doing that. Why are tanning salons not in phase 2? Joseph, I have absolutely no idea, and what I can tell you is that what the state often does is give the framework, and as we get closer, they add more details. And if you visit the state's website and you plug in information about a particular business, sometimes you'll find that they are in fact included. So as of this moment, these professional services, these office-based services, hair salons, barbershops, they're all being identified in phase 2. It is likely that there's going to be more as we get closer and as the regions begin to open, and we'll keep you posted. We, as you know, are here every Wednesday and Friday with a live update, and our next Facebook Live event is Wednesday, June the 3rd. But we'll keep you updated. If there's more information, we'll share it. Leanne, when can I open my tattoo parlor? I would put you in the second phase. I think that is like in keeping with barbershops and hair salons. I think that's the same category of business, if you will. And I know that we have been asking and believe that you fall in phase 2. Clearly, we don't know that yet. But again, you should be preparing your safety plans as you think is appropriate. Be prepared for the June 8th opening, and I promise that we are fighting to include you in that phase category, of phase 2, because we do think that you fall within that category. And there are a number of you. I know that Mike Boyce follows us around. I know there are a number of you struggling. Everyone's struggling, but you're struggling really hard and need to get those businesses open again. Kelly, can we play soccer now? I coach my son's team, and I'd like nothing more than to get outside and play soccer. At the moment, organized athletic activities are just not allowable under the state's guidance. Certainly, kids can go out and play, and they should go out and play. Be cognizant of who you're necessarily interacting with, just to slow the transmission and not put anyone at risk. But organized sports not permitted as of today. We believe they fit adequately in the phase 3 category of activities, and would believe in Dutchess County's health department is comfortable. By the way, permitting certain recreational activities the first week of July. We're just waiting for the state to make a similar decision, but. It's probably a good moment to remind you again how sort of government is supposed to work in the state of New York, and we think there needs to be a return to this structure. The state government sets broad parameters, and then local government, in particular counties, are responsible for implementing within those broad parameters. And what we've seen, going into the crisis, we understand in an emergency, you kind of centralize the response. You try again, if the emergency demand exceeds capacity of local government, then counties step in and help, and then if it exceeds our capacity, the state government, and then federal government. That makes sense. As we begin this process of returning to regular activity, it's time to reevaluate where we are as a government structure. It is okay for the state of New York to begin to reestablish that balance between state and local government, so that set the broad parameters like low-risk recreational activities being permitted, but allow us to make the decisions for implementation within those categories. Because right now, the state and the governor are making decisions that apparently golf and tennis are acceptable, but certain other recreational activities are not. Now, again, our public health officials, we're responsible for making these decisions on any given day prior to this pandemic. And we believe that now is the time to begin this slow transition again to rebalancing state and local government. The governor has every right, and we accept the need to establish those broad expectations with very clear measurements, and then, again, allow county governments regionally, and we think that makes sense, to begin to implement so that we can make some localized decisions that are unique and appropriate for us. I mean, again, you can apparently have horse racing in the state of New York, but no organized horseback riding. Why? Well, we don't know. Agriculture can function for certain activities. Equine, you can have single instructor, single rider, but there still needs to be some relaxing of some of those restrictions. And so on and on and on. There isn't a need for the federal government to making those kinds of very localized and specific decisions, and there isn't a need for the state government. In fact, it's almost a burden to the state government to have to decipher what makes sense in a low-risk recreation activity in Dutchess versus what makes sense in a low-risk recreational activity in Oneida County or Manhattan. So these are the kinds of things that I think we ought to start talking about, and it's a good time to have that conversation, because now it is that time to restore that balance, to allow us to make decisions like, can you play soccer? Because again, this county is prepared to allow summer recreational activity to occur after the July 1st sort of date, assuming our numbers remain as they are, and we would make that decision based on public health consideration. I do want to mention that, as you likely know, in the category of parks and recreation, lakes and ponds can be open. Several communities in Dutchess County did choose to reopen their lakes and ponds. Summer camps, campsites and RV campsites, that sort of thing, we are permitting to proceed in Dutchess County. And we are prepared to permit summer day camps. We think summer day camps in particular function as a daycare and therefore are essential. The state has not said yes or no. So, but we're prepared to permit those, and we'll do that through our public health department as we do. Overnight camps and sort of sleepaway camps, the state and the governor has said they've yet to make any decisions on. To that end, a lot of people are asking about gyms. Right now, the state of New York has said gyms fit in the Phase 4 category. We would argue that they can function to some degree in the Phase 3 category. I'm a gym goer. Mike Artega likes when I mention that I go to Mike Artega's, but I'm a big fan of Gold's and Planet Fitness and Fit Social and our CrossFits. And did I miss anybody? And Crunch, wherever you go, these places are relatively clean, and it's actually not. It's a bit of a misnomer and misleading to suggest to people that they're sort of these dens of iniquity. These are basically locations that have to be sanitary, and those owners and those ownership groups can keep people at distance and sort of make it work. That said, the state has said and the governor has said as of this moment they're deemed Phase 4, which would be mid-July. For reopening. Any plans for the 4th of July, fireworks and parades? Kathy, again, I would tell you that we're not prepared in Dutchess to have large community events where you would have the potential of vulnerable populations engaging and perhaps transmitting the disease. That said, I'm sure communities are going to be creative. We had our vehicle-based Memorial Day event, the Convoy, which was very, very successful. Very grateful to Mark Coviello and the Division of Veterans Services here in Dutchess County for their leadership and work and those partners that made it happen. I think you'll see some creative ways to celebrate Independence Day, but I'm hopeful by then we're in a situation where restaurants are open at certain capacity, where some recreational activities can happen, and we believe that is entirely likely. When will state and local parks open at full capacity? Well, I can't speak for state parks. County parks are open, and we just ask that you comply with physical distancing to the extent possible. We expect and ask that you perhaps bring with you hand sanitizer or wipe to kind of watch after your kids as you're out. We're going to be doing the same kind of cleaning we are. County parks are open. You should use them, and you should enjoy being outside. I'm not pretending to be a doctor. I can only tell you that we've seen a very little transmission of the disease among young people. We're continuing to monitor this Kawasaki's-like ailment that seems to correspond with COVID. Again, we've not seen a case of that in Dutchess. Dr. Wythian, Anil Wythian, is our Commissioner of Public Health. He is an infectious disease doctor. He is comfortable making with us permitting certain activities that include young people, and therefore we'll continue to monitor that. But county parks and most local parks are beginning the process. County parks are open. Most local parks are beginning the process of reopening. Do offices need to have social distancing practices in place before opening in phase 2? So I know a number of people are asking this question. You have to have a safety plan. Where social distancing is appropriate and can be maintained, it will be. Where it can't, then other safety measures ought to be taken. So there's no universal answer. So if you're sitting at home thinking you're going to go to the office and you're absolutely not going to have to be within 6 feet of somebody, the answer is that is not likely to happen. It's going to be, the state expects those plans to be specific to your business with certain protections in place. Again, the hand sanitizers, the personal hygiene, face coverings where appropriate, and physical distancing when it's applicable and possible. In some cases, there might be a plastic shield, if you will, between you and a guest or a customer. Those are the kinds of things that you're going to see, and each business is going to have to implement them in a way that works best for them. In Dutchess County, I will tell you, our expectation is that as we start the process of reopening our offices, now we're open and functioning, but as we start the opening of public access to most of our buildings, we're going to ask people to wear a face covering. Most of our services will first be provided by appointment. We expect that to happen between June 8th and June 15th, this transition into sort of refunctioning around the June 15th timetable as far as opening the public doors, if you will. And we're going to at least engage in that. We'll likely ask people that work for us not if you're in a congregate setting or a hallway to wear a face covering and to limit capacity in certain offices. When do you expect youth sports to open up? I think I've answered that to some degree. We're prepared in Dutchess County for that to occur the first week of July. Again, many of you have asked about travel teams. My expectation is if you're traveling outside of Dutchess County for a sports event or sports activity, certainly if it's south, it's not likely to be permitted or allowable just yet. So we're expecting around the July 1st timetable. Do college offices fall under phase 2? The short answer is yes. Professional offices are phase 2. So if you work in a college setting and they decide to be open, that would be the phase 2 category. We expect that to occur on or around June 9th. What about outdoor fitness classes? They can be done with social distancing. Jason, you're absolutely right. Now keep in mind some gyms financially can't make that work. I mean, again, some businesses may choose not to open under certain restrictions because they can't financially make it work. Dutchess County has asked the state of New York to consider, in essence, a pilot agreement that would allow us to allow certain gyms that have that kind of capacity, the ability to do outdoor training, to allow that to happen. Now, I can't tell you that you and somebody can't get together to learn to do yoga or to work out. That is your right as a human being. But the businesses, we're trying to get state approval for that to happen sooner rather than later in the phase 2 category. We think that it's possible and it's safe, and we've seen it happen in other parts of the country. Are outdoor picnic tables allowed for people to eat at? Peggy, if they're municipal, if they're at a municipal park or at a government-owned property, the answer is yes. Now, what's the difference? The difference is governments have certain degree of liability and protection that businesses wouldn't have functioning under the governor's order, which it does have the force of law. Municipalities have certain latitude and protections. So we've encouraged, and a lot of villages, towns, and cities in Dutchess have moved picnic tables and seating areas to courtyards and public spaces where you can take a meal from a local restaurant, go and sit down. As of this moment, under phase 1, outdoor seating is not approved under the governor's executive order. It is under phase 2. And we're asking people just to try to comply. We think it's best to limit that kind of activity until we get to the phase 2 category. Are optometrists allowed to be open for any emergency service or any necessary medical service? Yes, they are. For the routine services, we believe they fall under, We believe they would fall under the second phase category, but we haven't received that direction as of yet. When will we get guidelines for phase 4 so we can prepare? Gene, first go online now. Some of the guidances that you'll see already will give you some guidance. My expectation is the way the state has functioned so far, you're not likely to see the guidance until probably 7 to 14 days before the phase begins. So right now, we're a week, 10 days out from beginning phase 2. Those guidances are available online because other regions were a week ahead of us. You can see them and you can use them for phase 2. I'd expect that kind of timeline. Now, I'm all for speeding up the process. We ought to have those guidances out. The public and businesses ought to be able to see them and to begin planning. But again, if you go online now, you'll see some basic repetitive kind of expectations that you would be able to apply for phase 3 and phase 4 businesses. I'm all with you, Jen, on special needs students having in-person services. We certainly think that's safe. We certainly think it'll be safe this summer. And as I've said, I think it's a violation of their individual civil rights to deny them those services. And we're going to keep fighting for it. And frankly, the state has to comply. Otherwise, they're subjecting these young people to cruelty. Into a violation of their civil rights. And in New York State, the right to early intervention services, the right to special education is a constitutional, New York State constitutional right under our expectation that they receive a quality education. In phase 2, is it 50% capacity of office? It is not likely that. I don't have that specific direction. I would not expect that. I would expect that in a business or in a professional setting, it's going to be making it work. And we're not going to stuff people into a small office space. You still will have to have basic safety planning in effect, and that safety planning would automatically limit capacity. But we don't have direct direction yet on that. But that would be my expectation. I want to update you. The Dutchess County Office for the Aging does tremendous work serving seniors all across Dutchess County. We're thankful to Todd Tancredi and the staff at OFA. We have been providing meals all over Dutchess, thousands upon thousands of meals, delivered hot meals to seniors who have been in need. If you are a senior citizen or you have a loved one who is a senior citizen and they are in need of accessing a hot meal, we continue to provide delivered hot meals, and you should visit dutchessny.gov. Now, one of our most popular programs is our ongoing summer picnics, senior picnics. As you can imagine, under the circumstances in providing services for seniors, those senior picnics, like so many other things, are going to look a little bit different this year, and we're going to have to employ some innovation. Now, we've been hosting these picnics since 1993. In fact, I will tell you, I volunteered at one as a senior at Red Hook High School in 1993. I volunteered in the Northern Dutchess Picnic as a high school senior. So you should plan on this year. The picnic's looking a little bit different. We're still working on those plans. It's likely to be curbside, so we're going to bring the picnic to you. They're still going to have the same great lunch. We're going to support one of our local businesses in each of our communities. We're going to ask for donors and sponsors and support, as we always have, and we're going to ask for volunteers to join us to help hand off a hot meal and a picnic meal to senior citizens all across Dutchess County. And I think it'd be a great opportunity for you to get out in your car, drive around the community a little bit. They do as it is. You know, remember these picnics, you're driving to us as it is. So this curbside delivery, we're going to have the details worked out. I hope you'll join us this year for our senior picnics. They'll just be vehicle-based with still a little bit of the fun. So I hope you enjoy that. I hope you'll participate. If you're interested in sponsoring or supporting, you can reach out to us at dutchessny.gov. Visit dutchessny.gov, and if you'd like to volunteer, you'll be hearing more about it, but just sign up on our dutchessny.gov as a volunteer, and just note that you might be interested in volunteering for our senior picnics. Any update, Mike, on the Dutchess County Fair? They're still in conversation. It is not likely that you would have the fair look the way the fair has looked for the last 174 years this year. The question is, can they have some kind of fair-like activity during that timetable. They're still working on it. I can tell you that Andy and Vicky Imparati, Andy Imparati is a fair manager. He lives, breathes, bleeds the Dutchess County Fair. I'd like to suggest he's the only person in Dutchess County who feels more about the fair, or more good about the fair than I do. That said, they're trying to make it work. I will say to my friends on the Agricultural Society, it's an independent association. I'm asking you to find it within yourselves to find some way to celebrate the 175 years that fairgrounds has provided great entertainment. There are ways to do that. Please don't give up on us, and we won't give up on you. But it's not likely to look like the way our traditional county fairs have looked. We'll likely have a little more direction from the state, we hope, next week. And then the Dutchess County Agricultural Society will be making some decisions. What happens if the numbers rise between phases? Aaron, great question. That is, in fact, the reason you would delay the next phase. So yesterday when the governor said, well, they may not go to phase 2 in those upstate counties, it wasn't based on any change of data, which is what angered many of us and confused most people. Thankfully, that's been corrected. Those regions now are proceeding because their numbers have been relatively flat. So our expectation is if the numbers stay flat, meaning the hospitalizations and the severity of those cases don't rise, we continue through the phased reopening. If they do rise and our hospitals feel threatened, they're going to say so. Every day we're talking to our hospitals. Every other week we're communicating with the hospital administration, and our public health department is making those decisions. By the way, we would make that decision even without a deemed pandemic. If there was a mass casualty event we planned for and prepare for, and the hospitals were flooded by individuals, we have to make certain hospital-related decisions to make sure we can provide the care. If those hospitals felt like there was an increase, they'd tell us. We would respond. And we would have to likely delay certain aspects of this phased reopening. But if you don't see that happening, and we aren't seeing the incline, which we aren't currently, you would proceed to the next phase. When will guidance for schools be set? You know, someone posted online, and I like to do this. I try to stay on top of the communication. I will tell you this. Listen, if you want to insult me on Facebook, feel free. It's your right. But we try our best to respond, and so we try to get you the answers we can. There's certain parameters we have to live in. I can't protect you from the state of New York making a decision that may impose on your business. I can only fight for you. I can only educate, and I can only communicate, and to the extent we can put up a fight, we do. Believe me, we do. That said, the reason I mentioned that is somebody posted online that they heard that schools aren't going to reopen until January. If somebody told you that, they don't know it, because there isn't anybody today who knows what's going to happen in September, let alone postpone till January. So I want to dispel at least some of the gossip that occurs, but tell you that the state hasn't provided guidance yet, and certainly like anything else, when there's an absence of information, it gets filled with what we believe. I am hopeful and believe there is no replacement of a student-teacher relationship, and that we will be in a position to restore and reopen schools in a safe way come September, but there is no guidance yet on that. Are private racetracks acceptable in Phase 2? Dawn, private racetracks. Well, currently, the state of New York, again, some of these decisions, why they want to make it the state level is beyond me, but the state is permitting horse track racing to proceed and certain vehicle racing to proceed, but not, meaning like the NASCAR level races to proceed, but has yet to give guidance, as I remember, on sort of the smaller motor tracks. So the short answer is you are not yet deemed a Phase 2 activity if you are a private racetrack. And that, we might have in Dutchess, we have some of those smaller go-kart and recreational activities. Those currently are not deemed Phase 2 businesses. Will town pools open this summer? Well, first, although with limited capacity, the state has advised that pools can be permitted. So the pool in your backyard is fine. The neighborhood pool, the townhouse, the condominium association pool, we have been told is now permitted, meaning the state is allowing the county to move forward with permitting them. We're looking for that written guidance, but we were told yesterday on our control room meeting that those kind of pools can be permitted, so that includes municipal pools, but with limited capacity. Currently, it is only 10 people. My interpretation is that that's staff plus 10 guests at any given time. We have asked for that to be more proportioned, right? A percentage of total capacity, because a larger pool might be able to space out more people. A smaller pool maybe couldn't space out that many people. So right now, the state is saying that we can begin the process of permitting those public pools, those association pools, townhouses, condominiums, with, again, not more than 10 people. My interpretation, and this is my interpretation, this is currently Dutchess County's interpretation in the absence of any other guidance, is that it's staff plus 10 guests at the pool. How long do you have to wear a mask? Well, I think you mean for how long over weeks and months. We're asking you to wear a face covering while we know that the disease is prevalent. If you can't engage in physical distancing, then we ask you to use a face covering. I do want to confront one thing, and I haven't read the governor's order on face coverings yet. Yesterday, he issued an emergency, he said he was issuing an emergency order allowing businesses to decline service to people who choose not to wear a mask. I will say to you that that is not legally appropriate for those who have a disability that would prevent them from making use of that mask. The Americans with Disabilities Act is very clear. I am trusting that the governor does not think that we should ignore the ADA because we will not in Dutchess County. So the ADA minimum expectation is that accommodations must be made. Now, that accommodation could be that if you're going into a business, they may ask you to please just wait a moment while we let someone else leave and you can come on in. But at the end of the day, the ADA standard is the base expectation we have to protect those with intellectual and developmental disabilities. And therefore, again, his original mask face covering order included reference to if you have an underlying illness, if you're under 2 years of age, you're 2 and under, and if you have a disability that might preclude you from wearing a mask that you would not be expected to. I am saying right now in this county, we honor the ADA, and that is how we will enforce the rule in this community. And absent any other direction, that is our expectation, and I certainly hope the state of New York expects that adherence as well. So this will be for a little while longer, I suspect, as we get it later into the summer months and some social activities, recreation, community activities open up. You'll see that really masks or face covering really would only be necessary in certain environments. But as of now, we're asking you to continue to do that. When can association libraries open? Heather, I think we've been asked this question every time. I will tell you right now, the state of New York has said to us, if you are a library and you receive even $1 from any taxpayer, meaning it's a pass-through, it's a levy, it's a contribution or a check from your town, village, or city, you are permitted, that library is permitted to open with certain restrictions: curbside pickup, delivery, and limited in-library access. That includes any library that receives any taxpayer money. The libraries, New York State Libraries Association, as I've been told, has offered some different direction. We have asked Empire State Development Corporation to give guidance. I believe we've provided that to the MID-HUDSON Library Association. If that information is still not clear, please reach back to us. But that is the expectation, and that's what we've been told. Alicia, can restaurants offer outside seating and patios under Phase 2? The short answer is that falls under the Phase 3 category, although we are asking the state of New York to allow outdoor seating. Our region is making this request. It's one of the questions we've asked. Outdoor seating, limited capacity, physical distancing, in during the Phase 2. Now, maybe it's not in the first 5 days of Phase 2, but in the Phase 2 to Phase 3 period. In part because we are right now at the time where restaurants really need to get that income. Otherwise, they're not opening again. And please understand, we don't want to sacrifice public health. We don't. That's our concern, to protect people, protect your welfare, your safety, your health. But if we don't figure out a way to allow some of these businesses to function, they are never going to open again, and we will have a financial crisis and a fiscal crisis and an economic crisis unlike anything we've experienced, and it's already happening. So we believe in this region that outdoor dining can occur ahead of Phase 3. The state of New York has not said yes to that, but we are continuing to request that. Mary, are city buses still running? Well, county buses are still running, and the county buses continue to run for a limited route currently. But on Saturday, June 6th, Dutchess County will restore its full bus service. You'll see regular bus routes throughout the county beginning on Saturday, June 6th. Visit dutchessny.gov for more information. What I want you to know is that there'll be certain safety planning in place. You should be prepared to have a face covering when you're on the bus. If you don't have one, one will be provided for you. And there will not be any fare charged for at least the immediate reestablishment of those services. Right now, we are not charging fares on the buses for those that are running. We will not charge a fare as we reinstitute the full service. At some point, we will transition back to a full fare schedule, pay the money fare. But right now, we're going to begin that process with maintaining no fares on transit services beginning on June the 6th, full service. Give a hand to our American Sign Language interpreters. They have been very helpful, and they were very appreciative that I just took a drink. Thank you for showing some emotion. They've been with us all the time. I want to mention that the Dutchess County Human Rights Commission, the Human Rights Commission is co-hosting with the Poughkeepsie Healthy Black and Latinx Coalition, 2 forums held on Zoom, coming up soon on Zoom. One is June 2nd, 3:30 to 5 p.m. in English, and one is on June 4th, 3:30 to 5 p.m. in Spanish, to talk about accessing testing, navigating the healthcare system, access to the county's mental health services, including Helpline, the Stabilization Center, our trauma team and mobile crisis unit. If you have a request or you're looking for information, you can see you can see above us that forum information. You can reach out to the commissioner of the Human Rights Commission, the head of the Human Rights Commission, Jody Miller. Jody is J Miller, JMILLER, at dutchessny.gov, and then follow the Dutchess Human Rights Commission on Facebook for additional information. This is probably also a good time for me. I'm not going to stray too far into this topic, but to tell you I can only tell you, like so many of you watched with a great deal of horror what occurred in Minneapolis earlier in the week. Every life is precious and every life needs to be protected, and justice in the case of the taking of George Floyd's life needs to be served. From the president right on down to local leaders that have said absolutely justice must be served. And so I ask our residents and neighbors to be vigilant in our commitment to be fair and decent and kind to one another. We certainly don't have any tolerance for racism. We don't have tolerance for violence. We don't have tolerance for hate in our community. We'll work with you. We'll try to help you find the source, to find some resources to be helpful. That's why the Human Rights Commission exists. They do wonderful, wonderful work. And I ask my friends and neighbors in this county to be calm and to be patient and to be vigilant in our protection of each other's civil rights, our human rights, and our very right to enjoy this community. And I really think as a community we ought to be proud of the fact that even though we have so many differences, and I can't see the Facebook feed, but I'd have to guess there are people talking from both sides of the conversation. Just be nice. Listen, as I said before, if you think, saying nasty things about me is the way you should express yourself, you have every right to do that. I'd ask you probably not to say nasty things about your neighbors. At the end of the day, we all come into this world with different views and different opinions. And by the way, the government is about choices. It's and how those choices affect each other. We don't always have the right answer. We just have choices to make. And if you disagree with someone who's on this Facebook feed now, just be kind to one another. Just there's no need to be harsh. There's no need to attack one another. There's no need to shame or bully one another. I think that's who we are as a county. We are kind and decent people, and we've seen it. We've seen it these last 2 weeks or these last 2 months. We have seen our vigilance. We have seen our resiliency. We have seen our strength. We have also seen us be kind, and we know how far we can be pushed. And I know that you are all at the breaking point, and you want very much for things to be safe, to be healthy, and to be back to normal. I know that. Believe me, I do. I'd love it too. As we move forward together, we have to do this together, and we have to be respectful of one another. And I just ask you, I think that is absolutely critical as a community. And by doing that, we'll hear each other. We'll know that there are differences of opinions. We'll accept that those differences of opinions exist, and we will try to find the right path to moving forward. And with every decision we make, we've made a pledge to you, and this is something that I think is critically important. It's why I do take issue with the offhanded comment and the answer to a question the governor made yesterday. I'll be the first to defend a good idea and the first to defend a good statement, but I'll tell you that this is more important now than ever, because as we start to restore activity in this community, you should expect certain things from your government officials. You're already all being told something you don't necessarily want to hear from people you don't necessarily believe. So if you think the governor's always right or you think he's always wrong, that is your right to believe. If you think I'm always right or always wrong, that's your right to believe. But what you should expect from all of us is that we work together, which is why I am absolutely convinced now is the time to begin that restoration of balance between state and local government, because we have to get back to ensuring that the government closest to the people is able to be of good response and good service, right? Being handcuffed in a sense doesn't allow us to do the job that you expect, to be collaborative in the way that you need us to be. You should expect us to be clear. Here are the data points, here are the benchmarks, here are the phases, and if there's a reason why you're not meeting them, we're going to tell you that. That's the commitment New York should make, and that is the commitment we make. It's why I'm here twice a week trying to give you updates. We should be honest about our risks. Folks, as we restart activity, people will get sick. There are risks associated with living. There are risks associated with this, and we ought to be clear about what they are. And that's why as we reopen activities, the question about, well, is a business liable? That's a great question, because in some ways you will be. You will be if you don't adhere to a safety plan. You will be if you just choose to ignore the governor's orders. You do assume certain risks. You should know what they are. We should be able to tell you what they are, and you should expect us to be specific. And I'll tell you that there is room for improvement by the state of New York in each of these categories, and there is room for improvement by us in each of these categories. So continue to hold us honest in that regard, and please continue to ask the questions. We got one or two more. What's happening in our courts? As I understand it, the local court system, again, it's a New York State court system. So even if it's the town of Red Hook Town Court or the city of Poughkeepsie Court or the Dutchess County Court, it's governed by the New York State Office of Court Administration and the state of New York. They are beginning the process of reopening court activities. We believe, I think, June the 8th. I think the goal is June the 8th to begin restarting some of those activities. You'll see some more information about that. You should visit us at dutchessny.gov. So I think we've covered just about everything. I want to mention that we are doing virtual Narcan training. You should be make yourself aware of that if you are at home and still have time to be able to do that. We're doing they're held the fourth Wednesday of each month, 4:30 p.m. We want to be sure that you participate. If you're interested, find us at dutchessny.gov. You can register online to take part in Narcan training. It's another way that you can be off the sidelines and be engaged in solving the problem of opioid, heroin, and drug abuse or drug addiction, and help people and help us save lives. If you're sitting at home and you still need some assistance, our COVID-19 hotline remains available, 845-486-3555, weekdays only. For our hotline. If you have a question and we're not there, leave a message. We do have extended hours, but weekdays only. We'll get back to you. There's a series of prompts that might help you get through the system. And of course, there's always, at the end of the day, a live person who will be able to speak with you if you have specific questions. If you're sitting at home and dealing with an anxiety concern, stress, tension, what have you, mental wellness, we have a comprehensive mental health program administered by a great team of professionals led by the Deputy Commissioner for Behavioral and Community Health, Jackie Johnson. We have a wonderful, wonderful team of people. We partner with organizations like Family Services, Mental Health America, People Inc., and others to provide direct care, Lexington Centers for Services, etc. Our helpline number is 845-485-9700. I have ended most of these town hall meetings this way, so I'm going to do it again. If you know you're dealing with a mental wellness concern and you're dealing with a mental illness concern, you should call or text us anytime, anyway. we're available to you. But even if you are simply overwhelmed, and it would be easy to be that way, you're concerned about your business, you had a rough, long day with the kids, and you just need a break, and the kids are in bed, and you're in the corner of that laundry room, and you want to sit down and call or text us, just do it. Just do it. They're professionals that are there to be helpful for you, and we want to do that. So, ladies and gentlemen, thanks for joining us yet again. We'll be back with you live next Wednesday, and again the following Friday. In the meantime, stay healthy, be safe, and be kind to each other.